Hi, my name is Carly Soul. For the current events presentation, I went to Twitter and I searched the hashtag bioethics. I came across this article titled My 92-Year-Old Father Didn't Need More Medical Care, written by Ezekiel Emanuel. Basically, what happens is the author is writing about his father, who's 92 years old. He has a fall at home. Um, Wife and his other son bring him to the ER. They do a CT scan, MRI, chest X-ray, um, and basically they think possibly he has pneumonia. They maybe see infiltrates in his chest X-ray, but they definitely see a brain tumor on his MRI, and so they admit him to be inpatient in the hospital. When the author gets there to check on his dad, he notices first thing his dad is hooked up to all these monitors, and he, has IV antibiotics running, and just kind of is curious what the purpose of all of that is, given what he thinks. He's also in the medical community, what he thinks is wrong with his father. So he leaves his dad's room and he goes and talks to the neurologist and neuro-oncologist, where they basically tell him there's no treatment for your dad's brain tumor. Anything we did would just shorten his life and definitely destroy his quality of life. So your best option would be to, there's nothing else they can do. They don't really give him another scenario other than that. What his dad notices what the author notices right away is that no one considers his dad in this. He knows his dad wouldn't want to pass in the hospital, wouldn't want to be connected to all these monitors, just would want to go home and die peacefully surrounded by family. But the hospital didn't even ask if he had an advance directive or didn't consider his dad really at all in the process. So the son decides to get his dad discharged. And upon doing that, he asks if there were any palliative care consults that could happen. Prior to his dad leaving, they tell him, no, there's nothing we can do inpatient. We can give you someone to call tomorrow and set it up for later on. So he decides he'll just handle it on his own, basically. Discharges his dad. The person, one of the care partners or caregivers at the hospital that's wheeling him out actually suggested a possible at-home aid, just because the son acknowledges the fact that the hospital didn't give them any resources and didn't really give them anything to work with when taking his dad home. He basically was going to have to fend for himself to find home health care for his dad when he goes home to pass. And what he acknowledges in the article is basically just that the hospital was just going to work off convenience, keep his dad on the monitors, keep him on IV antibiotics for no reason. He had no symptoms of pneumonia, and basically just works out of convenience mostly, and that they really didn't acknowledge his dad or this terminal diagnosis at all. There was no consideration of grief counseling or no resources for home health if he wanted to pass that way. So they just really didn't consider the patient at all. And what he basically, if it weren't for him, his dad would have been stuck in the hospital, probably would have passed there, but instead got to go home and pass surrounded by family around a week later after that diagnosis. So basically, the bioethical dilemma in this article is just that the healthcare system doesn't address the patient at all individually, and instead they work out of convenience. So they're really just looking at the big picture, and they don't consider each patient as a whole and the best scenario essentially for each individual patient. So there was no that I mean, if the patient got lucky that his son works in the medical field and was going to advocate for home care and get all that settled, but not everyone has that. And so that's a big issue where we're just kind of working to, ironically provide the most costly and efficient care without looking at how patients want to actually live given a terminal diagnosis or, given really any diagnosis. And instead we just do the easiest thing, which is to keep them on monitors and treat potential diagnosis and just do what makes the most sense for the healthcare system. So some bioethical principles that I noticed noted in this story were, first of all, you can tell that the patient's autonomy is violated completely. They never asked if he had a DNR or if he had an advance directive. If he was a DNR, that is. They didn't really consider the patient at all. They started him on antibiotics and put him on all the monitors without asking even his wife or his other son if they had any idea. They just completely overlooked the patient's autonomy. And honestly, the son was the only person that considered the autonomy of the patient. And that just simply shouldn't be the case because everyone has the right to their autonomy and should be able, if they're medically able to, should be able to make those decisions for themselves. I think this story challenges beneficence. I think it was kind of like we didn't do the good of the patient. They did what was easiest and what was good for the hospital. I think the son acknowledged what would be best for the patient and really worked for his father's best interest, thankfully, but the whole story basically shows that no one was looking out for the best interest of the patient, which was his father, as far as the healthcare system is concerned, and that's a problem. I think they also just threatened trust because, they had him on antibiotics for really no good reason other than maybe they saw infiltrates in a chest x-ray. But they also just, it's hard to trust a system that can't even give you resources to die at home peacefully the way you want to, and that doesn't acknowledge you for your ability to make your own decisions and to decide how you want your care to go. So I think that kind of threatens trust, and it kind of shows a big flaw in our healthcare system. And I think that's why this article is so important. I know for me personally, I work in pediatric hematology oncology, and so this is a huge topic for us, and just the lacking resources that we have for that population is astounding, seeing as how far medical care has come. I just think by now we should be further along. We should have these resources available to give to a patient right away if they end up with a terminal diagnosis. I think also how the author mentions that, why is there no counseling or no, grief support for a terminal diagnosis in the hospital is just crazy, honestly. Like, that should be first thing. We should have someone there to support them through this and help them kind of make that decision about what they're going to do now, given that diagnosis. I know, like, when my grandma recently was put on hospice at home, and it took us coordinating everything in order for her to get that care, even though she was in the hospital when she decided that. They didn't coordinate that or help her coordinate that at all. And I just think that should be a resource we should have for this population. And it really just shows that, like, our healthcare system needs to stop working out of convenience and instead needs to consider the patient holistically, because that's the most important care we can give, and that's the only way to treat the patient entirely. And so I just think this article really sheds light on some flaws in our system and some areas for improvement. As far as the code of ethics, nursing code of ethics, I think it violated provision 1. It says that health should be through relationships of dignity and respect. I don't think they did that at all. I don't think there was much respect for the patient, and I don't think they really gave him much dignity. They didn't give him control of his care. They just did things that they knew to do that would possibly help. He just wasn't really considered, and again, he's lucked out that that his son could advocate and could help him so much, but not everyone will have that scenario. And so it just makes you wonder what other people are going through in these situations where they don't have that person to fight for their care and to get them out of the hospital to die the way they want to, with dignity and respect. I think implications for healthcare, like I said, I think it sheds light on many flaws that our system has. I think this hopefully will stimulate some change in end-of-life care. I think that we need to have resources at the hospitals available to help if people want a palliative care consult or if they want to figure out home health. I think that should be easily accessible to anyone that wants it. I think we should have information available. Hospitals should be able to coordinate more of that and just make it a more seamless process for patients, because that's already such a terrible situation. And then on top of it, making families coordinate so much of it is just so unnecessary, in my opinion. So yeah, I really hope for healthcare this sort of helps rework the system, kind of points out the flaw, and maybe stimulates a change. I really value this population, and so I'm really bummed that we haven't made more progress. But that's my insight on this current event. Thanks for listening.